right. Welcome to expanding the conversation. Today we wanted to talk a little bit. Richard and I are going to talk a little bit today about surviving COVID-19. We think this is a real topic, and everybody's talking about it. And we wanted to share our conversation and expand that to the rest of the audience and the virtual space. I'm going to say, I think, as a matter of fact, everyone knows that we are living in a pandemic. If you do not know that, maybe you are in a really good place. The rest of us are either locked into our homes or taking special precautions as we move about in trying to figure out, how we're going to um, still live a certain high quality of life, right? As we go through this pandemic, I think we haven't, as a people, as a race of human beings, we haven't had to deal with this maybe for the last 100 years or since the last 100 years. So I think it's a major issue. Um, what I wanted to do, Richard, is kick this conversation off because we're going to get into a little bit about some of the fundamentals in terms of what's going on in terms of COVID. It's a real viral infection. That's out there. We've got about 610 deaths worldwide. I think the last number we looked at, on about 143 deaths in the United States alone, and in our home country, Guyana. Quite fortunate in terms of the numbers. 19 deaths. Of course, you can't tell the family members who lost those
Yeah, I
folks,
agree.
right? To them, it's very personal. But across the country, just from a big picture perspective, we're really looking to keep those numbers as low as possible. But I think the biggest thing for me, Richard, about this is that COVID has really affected us on a personal level. And I thought, one of the things I wanted to talk about is how has COVID been affecting you, right? You're in a different different part of the country than I am. You've got different circumstances, and even the people who are sort of listening in, they've got different circumstances as well. Why don't you kick it off and tell me a little bit about maybe what's kind of like the worst thing, or even some things that have been positive about what's going on COVID where you are.
Sure. Yeah. Welcome everybody again to another of our conversations. I think this one is relevant and current. Certainly, there's a lot of um, perception and misperception of what COVID-19 is and how it impacts everybody. And we wanted to share a little bit about sort of how it's affected us personally. I know we're not a pool of the general population, but I think everybody adding a little bit of story and their experiences certainly helps us to sort of face it uh, a little bit more informed. You can take the information, you can use it or not use it. It's entirely up to you. But you mentioned being in a pandemic, right? And you think about 100 and something years, most of us alive right now have never, ever seen something like this.
Right.
And we're certainly never lived in a world as connected and interconnected, whether some of us like it or not, as we do today. And so it's certainly unprecedented, but the the beauty about it, which is not a beauty, but the good news I think is that we're probably more well equipped than we've ever been before in history to
Right.
fighting it, and more connected and having the ability to share experiences and information and resources with each other. So I think I being the overly optimistic person that I am, I believe that we'll get out of it. I mean, again, people are dying and they're going to continue to die. Hopefully not in large numbers. But in terms of personally, I think what's been hard for me, that's I think probably a little bit unique to my circumstances, is that I my wife's an infectious disease doctor, and so she's an essential worker that has to wake up every day and go out there. and face it. And so, as it gets worse, which in our state of South Carolina, it's getting worse. Um, the impact that it has on our household directly is pretty significant, right? Like, kids can't run and just hug her when she comes through the door, or the excessive long hours, and the stress of dealing with just managing the patient load, and the hospital not always being equipped. And I think we're fortunate that we live in a part of the world where there are probably more resources than a lot of other places. So that's sort of been the hard part, to kind of see, you know, be close to somebody that's directly impacted, that's serving those that are affected by this, and some of them are dying and some of them are recovering. And so it's sort of like, you get to hear the good stories of the progress that we're making, and the people that are being saved. But on the flip side, those people are having to sort of deal with things that they've never had to deal with before, and that becomes hard for them as well as everybody that's connected to them, right? You think about a doctor that's breastfeeding her kids. I mean, she probably has to probably stay away from doing that for a while, because of having to deal with it. So there's that direct impact, and a direct impact on my household.
Right.
But on the flip side, I think there is sort of, this is uh, probably what I would consider a moment of reckoning for all of us, right? What does our lives look like, and how are we able to take something that's negative, and find a positive in it, and spin it in a way that allows us to look at our lives, and continue to live, right? As you said, find a way
Right.
to
Yeah.
continue to survive, and be good. And so we've done a lot of things together now. We were forced to. We started planting a garden together, and we try to spend a lot more time with the kids and do more things around and out and about. So
Yeah.
there's some positives that have come out of that, which I've appreciated. I mean, I'm big on having family dinners together, and it seems as though we've been fortunate enough to always be able to do those. So
Right. That's nice.
that's sort of a little bit of my story. I don't want to
Yeah.
go on for too long, but
No, I think no, Richard, I appreciate your story, man, because I'll tell you something. I got a cousin out in Canada, and I remember him sending me a picture of wearing an N95 and him greeting his children, through a glass, because he couldn't be there. He had to live separately away from his family. So I think you fall into that category of where there's a direct impact because a family member, a spouse in this case, is actually working directly with patients. I am not in that situation. I've been fortunate. Rhonda and I have been home, working from home with the children. And I think for us, the most difficult situation has been with the two children, a 5-year-old and a 12-year-old. And I think when you're 5 years old and you're 12 years old, you want to be with your friends. Like that's all life is about when you're
yeah,
five and when
your
you're 10.
parents aren't cool enough.
And so exactly, but even if they are, right, a huge part of your life is defined by how you interact with other,
Hmm.
other children in terms of just how you rub shoulders, as we say, and how you kind of find yourself. And I think that's been really difficult, for Jaden in particular. He was in a he had signed up and was a big part of a play, and he was one of the youngest of the students that got into the play, and he's big on acting and everything. And I remember as the news started to come out, they weren't gonna cancel the play; they're postponing it. And we had already realized they would have to cancel it, and it was tough because we had bought all this costume, and he was ready to do it first time. I'm gonna be famous, And then COVID comes and just takes that away. So I feel it for the children, to know that they can't be out there, and even though Gianna's fine, she understands it. I've also been strengthened by the fact that she reminds us to wear a mask. She asks, "Hey, when can we go to Ghana?" And she tries to work this situation out where we should stand in the sun, we should do all of these things to kill the germ so that we could start getting back to normal life. So that's been tough. In addition to watching, my brother passed away earlier in the year, and then watching other family members of people I know pass away, and not being able to be there, in as much as I appreciate what the technology has been able to do, there's nothing that really substitutes for a hug, right? And being there. But I think that's on the flip side of that, like you mentioned, there's been this positive where, and I mentioned in our last discussion that during this time, I felt really close and connected to my family. And we've utilized the Zoom platform for birthdays, anniversaries, whatever reasons we could come up with to sit down. We do movie nights, and all these things, right? And we pull these things together. Even you and I have been connecting with other friends across the St. Stanislaus College community, alumni community. And so that to me has been definitely a positive that has really helped. And I kind of encourage other people to think about how they utilize, this platform to do that as well. So, so no, thanks for sharing that. Like I said, there's probably a couple of things that we probably want to talk about, though, because I don't know that everybody's taking this thing seriously. Like I am locked up at home, and my office said, "Hey, you can." I mean, I've been fortunate because what they've said is you don't have to come back out yet. They're in this restricted phase. And I know some people have to go back to work. But I know there's some people, you look at certain places, you've heard stories of young people that are just not taking it seriously. Maybe they feel like they're not at risk or something. And then there are those who believe that this thing's just a political propaganda. I hope by now that sort of myth, if I'm going to call it a myth, is gone from people's mind. I mean, this is a real thing, right? Tell me it's
Yeah,
a real
right.
thing.
Yes, I mean,
I'm not
from
locking up
all
at
that,
home for no reason, right?
from all that I've heard, and I'm hearing directly from a source that's seeing people every day. Yeah, no, it is real. You laid out the numbers earlier, and so people are dying. They're dying every day, and other people are having to deal with that. And there certainly are some people that aren't taking it as seriously, and I think this is sort of everybody wants to enjoy themselves. We get that, right? It's hard. It's tough. Everybody wants to go out and maximize their fun and live life as though it's their last day. But and I mean, the upside to it, Kofi, is that a lot of people are living as well, right? They're getting sick, they're recovering, and they're continuing to live.
I think that's great.
One of the things that that hits me, and my wife reminds me of this more often. It's not so much of only you. It's who do you get sick when you get sick that then dies as a result of it. And in some cases, we don't know who those people are, right? You go to the supermarket or the market, or you're on a bus and you're sick and you cough and you pass it on to somebody else, and they pass it on to somebody else, it passes it on to somebody else, and then somebody dies just because of irresponsible behavior that could have been prevented. So
Yeah.
there's certainly long-reaching implications to reckless behavior, I would say.
Look at this. I'm going to kick it in because one of the things that I think we would address is the wearing of a mask. I started wearing a mask real early. And I know there was a lot of talk about N95 masks before, and those kind of disappear off the shelves. I'm gonna switch into a different kind of mode here, simply because I feel like I know a little bit about this, and I think it's important for people to know this. I mean, if you're gonna wear a mask, I think there are people who are concerned that they can't breathe, right? And you're breathing back in air that is an issue. And I think what I want people to understand is that this is a viral infection. It's a virus that affects the respiratory system. What that means is this virus goes into your respiratory cells, your lungs, your nose, right? Your airways, makes its way into those cells and infects you. And so wearing a mask is like, primary defense, right? Just being able to keep the virus and the droplets out and away from you. And of course, if you're going to wear a mask, there are a couple of things that a mask should meet. For example, you can't imagine the first thing that a mask has to do is to be breathable, right? You can't wear a mask made of plastic. That would be the worst scenario, because of course you can't breathe. And so, but you can't wear a mask that's so open, right? Made of a mesh to the point where everything is still coming in, right? So the logic there is it's got to fall somewhere in the middle, right, where you can breathe and you've got the right level of protection. And one of the things I've been saying to people, Richard, is if you try on a mask, if somebody gives you a mask and you try it on and you feel like you're stifling, you feel like you can't breathe, you feel like you're having respiratory distress, my advice is try something else, right? Don't get to the place where you feel like, look, I'm just not going to wear a mask because I can't breathe or something else. There are some masks, especially the ones that people are making masks at home, and there's been a lot of push to get a lot of these things out. My advice to people is try something, try a different mask, surgical mask, something. Protect yourself and protect others. I think if your mask is breathable and comfortable, I think you should be good. I don't know what you think about that. I know you wear your mask and try to protect yourself and family, right?
Yeah,
Looking for
certainly.
yours?
Yeah,
There you go.
no, no, certainly. One of the things that I mean, they're all different kinds of masks, right? And certainly, it's been proven that wearing it helps slow down the spread of this, right? Because this is not, we're not wearing a mask in isolation, but let's talk about the mask alone for now, because I think
Right.
it's the mask plus all the other things.
Right.
Certainly, I mean, it has to, you have to be able to breathe in it. To not to make this a joke, but you have to smell your own breath a lot more than you probably did before. So brush your teeth regularly. But wearing the mask is essential. If everybody's wearing it, and the way I've heard it is not only, so some people might say, well, if I'm not sick, then I don't need to wear the mask because, but we know that people are asymptomatic, right? It's not always going to show in symptoms. But
Absolutely.
the idea is not, even if you're not sick, by wearing it, you sort of, if somebody was around, and I think there are different depictions out there of,
Right.
person being sick wearing a mask, not wearing a mask, person not being sick. And so I think that the general consensus of the people much more intelligent than I am is if everybody wears a mask, then it's significantly less likely that we'll continue to spread this. But yeah, I mean, the mask has to be comfortable. You should be able to breathe in it. One of the things that I think I took for granted, and we generally take for granted, is you've got to wash it. So don't wear your mask all week and not, and it doesn't have to be an extensive wash. I think a little bit of soap and water and just let it dry.
Right.
Um, and even some of the those surgical ones that they use in the hospital that some people have access to, I think you don't have to like screech it as we did when we washed our
Yeah,
clothes back in the day.
yeah.
But you can just maybe shake it up in a little bit of soap and water and just have it dried out in the sun or wherever, and that goes a long way. But I mean, the general consensus is wear a mask. Like don't and any kind of mask. It certainly, as you mentioned, needs to be somewhat somewhat of a barrier to having
Right. And,
spit
and,
and,
and
and,
the
and
important
different
thing
things
too
from what you
is
might
if
get.
you wear the mask, keep it on. I see people wear a mask, they're ready to talk, they move
Yeah,
it. Like people can
pull it
still
down.
hear you. We can still hear you. At least, one of the benefits of having the mask on is if somebody really upsets you, you could probably say something to them and they can't read your lips.
Yeah,
Right? But
it's like showing a middle finger without without anybody
right.
recognizing.
But I mean, but on a serious note, you're right. Practice wearing the mask, make sure it's comfortable, make sure you can breathe, and keep it on, right? And keep it on. I think another sort of important topic that we could hit on is vaccines, right? From my
Yeah, that's
perspective,
certainly your area of expertise.
right,
Not to
right.
interrupt you.
I think I I mean I personally believe that unless we get what they call herd immunity, which means that all of us somehow develop, we get exposed at some point and we develop some level of immunity, the virus is going to continue to spread. And I think that that's going to be an issue. And at the death rate that we have seen, that could mean that more people could be dying. And I think some of the initial social distancing, which I call physical distancing. I believe we should be physically distant, socially close. And so some of the physical distancing rules that we've heard, were important to ensure that we did not overwhelm our healthcare system. And then as people go back out, I think people have got to take those precautions, because it is my belief that until we actually get a vaccine and folks have the immunity necessary to withstand this virus, we're going to have some difficulty, or we're going to have a very completely different way of life. You can imagine. And I think the general issue for some people about vaccines is that they feel like vaccines are just not safe. There's a lot of myths on Facebook, and in other places that I've seen about vaccines. For someone who's worked in the vaccine space, who actually worked in a lab trying to make a vaccine, I feel like I appreciate and understand what it is a vaccine is trying to do. And in a very simple way, I mean, the idea behind vaccination, for those who may not know, is simply really to give our bodies the level of immunity necessary, right, to fight off an infection. And you could be naturally vaccinated, right? You could be exposed to a germ, not show any symptoms, or show symptoms, develop the disease, and then you might be protected against the disease, going forward. I mean, a vaccine
And
process, that's what a vaccine process is trying to do, right? We're trying to
yeah,
take that what we call antigen, or that bug or germ, and we're trying to expose people to it in a way that is very safe, right, and effective. So, and that's the two things that really go with vaccines: safety and efficacy. And there's a long process to ensure that from the time you conceptualize a vaccine to the time that it actually goes out on the market, right? It has to go through multiple stages, including what they call clinical development. You got to test it in populations of people that may be compromised, and you have to test it in population of people that are healthy, and you've got to ensure that the vaccine actually works. There are a couple other things that you have to ensure: that the vaccine also doesn't enhance the disease. There are some cases where the use of a vaccine could actually enhance the disease. And so these are all things that researchers are working on. That's one of the reasons why a vaccine's not out. But I think with all of the push in terms of government funding, with the techniques we have in biotechnology, some of the sequencing we've got for this, genetic sequencing for this virus, I believe we can get to a vaccine relatively fast. What I say to people, and this is not medical advice, but I say this to people in general: if you're going to make a decision about your health, right, this is the kind of thing you need to be discussing with a doctor,
hmm
because whereas a vaccine might be relatively safe for the general population, there might be individuals who need to be concerned about the vaccine. And that's a case where you need to sit and talk to your doctor. But the general push here, right, is not some conspiracy theory to do something to people and turn them into slaves across the globe or something like that. The goal really here is to save lives, right? And I've been on the front line of that, and make vaccines to go after specific diseases. And so I feel like I understand that process. I want people to understand that. But at the same time, there are risks that are involved with any medicine, right? If you think of the vaccine as a medicine, if you take Advil, for example, for a headache, right, and then all of a sudden you get a rash on your neck, you have to decide whether itching that rash is worse than your headache. And so it's a decision of risk, and sometimes there are side effects. But at the end of the day, you want to have that discussion with your doctor. And these vaccines, I believe, will be safe, will be efficacious once they go through the process of testing, and they pass the necessary milestones that they're supposed to. I think if we can accomplish that in the shortest possible time, Richard, I think that's our biggest win. That's what I think.
Yeah, and I mean, I appreciate that little background on vaccines, and I know it's a lot more complicated than you laid it out there, but I certainly understand it. Um, th- I know talking about sort of like just acquiring immunity, which is something I think that they've recognized that people do, right? So there are cases where people got infected, they recovered, and they can extract the plasma from their blood and put it into somebody that's sick, and they've recovered. The problem is you can't do that over a large number of people, so it can only work for a
Right.
small
You need
number.
more people to be infected to do it.
Yes, and I think you probably maybe you can expand a little bit on, because you did say that it takes a long time to develop a vaccine, but I think and this is my laboring work in here, that, you know, one, everybody across the world is going through this. So this is no longer something that an individual country or an individual
Right.
city is dealing with. It's a pandemic, right? So everybody's working on a solution. I think we're more interconnected as we've ever been, and I think together as a world, I feel like we're much better than we've ever been. But I haven't been around that long.
Right.
But maybe speak a little bit to how can we move from you know maybe the beginning of 2020 to in July and August, talking about being at the cusp of potentially getting a vaccine soon, how we're able to do it in a much shorter space of time, because I know you've got insights into why
Right.
we're able to do that faster.
Yeah, so I'll just make a couple of points here, also in the interest of time. One of the first things is we are familiar with COVID. Although this is COVID-19, there have been other similar outbreaks before. People may have heard of SARS, for example, right? And so there was an outbreak before in the U.S. and I believe in the Middle East as well. I believe there was MERS, if I'm getting my abbreviations correct. So there have been these respiratory viruses before that, very similar to the COVID-19. And what we find is that people were already studying the virus and how it behaves, and they actually started developing vaccines for previous versions of the virus. So one of the things about today's research is that it's able to benefit from some of the work that was done previously. That means they understand their aspects of the virus, they understand how it behaves. If there are things that they were able to overcome, research strategies that they were able to implement that was going to overcome a particular hurdle, then they already know what techniques they have to use to get past some of those hurdles, right? And so they're much further along than if this was really novel, so new, we've never seen it before. Then now you're starting from scratch. So I think that's the first thing. We've got some prior knowledge, and that's helping. The second thing is when it comes to genetic sequencing. So one of the things that really helps is to understand, the genetic sequence of the virus, right? And what those genes are doing. And today we've got all sorts of great sequencing technology. As a matter of fact, when this first came out in China, they were able to share some of the sequencing information with other research labs. And that information is quickly shared. It's not in a competitive environment, as you mentioned before, where you're trying to beat someone to market in terms of making money, so you don't share information sometimes. Here's a case where the information is shared widely, and every smart person, 10 times smarter than me, right, and even more, is able to look at that information and talk about how they think they can strategize and work around it. The other thing is funding. Again, usually in these environments, there's limited funding and there's usually private funding. Here's a case where governments and private sector, I think even Facebook, I may have heard, you've got all these other big fund agencies and, billionaires are throwing money to this, right? So you've got the resources that are coming with it. And with those resources, those financial resources, also come other technological resources that can help to speed things up, right? So I think those are probably four reasons why we're able to get the vaccine out faster. The final one is working with the regulators here, being the government, to be able to expedite certain testing. And there are people who are volunteering or looking at aspects of the approval process, and looking for ways that we can actually cut time out to that process so that we can get a vaccine on the stage much faster. So I think those few things. I think prior knowledge, the fact that we have sequencing information, a lot of money being thrown at it, technology and the access to technology, and the fact that we can work with governments to sort of expedite some of the approval process will get us to a vaccine hopefully much faster than 10 years or 5 years. That's the hope, right?
Yeah,
That's the hope.
that's good news, and hopefully we'll never lose as many people as pandemics before us.
Yeah, yeah.
Yeah.
Yeah, let's wind
Okay.
it down, Richard. I think
Yeah.
one of the things we probably wanted to end this conversation with about is responsibility. And I think that's really important because I tell you, one of the key things here, and you mentioned it earlier, is this realization of how connected we are and we need to be. And humanity, I think over time we've had challenges with that. When you look at, for example, environmental challenges, we're trying to, talk about things like climate change or pollution, right? Or the classic story of you living upstream of a river and somebody lives downstream. And if you're dropping crap in the river, right, upstream, the guy downstream's got to deal with it, right? And if you're smoking in a minibus, for example, in Guyana or on public transportation, then people have to breathe that in. Here's a case where we've got this interconnectivity, right, of humanity, and we've got to find a way to sort of protect each other. What do you think? What kind of obligations do you think we've got to each other to make sure that we fight this thing, man?
Yeah, yeah, we all have a role to play, right? I mean, this conversation that you and I are having is a recognition that we have a role to play.
Right.
One of the things that I think we are aware of this, but I think we probably should take special note at this time is that we as a world are interconnected,
Yeah.
right? I mean,
Definitely.
this thing started somewhere on the other end of the world, and we know as small and remote as Guyana is, it's there. I think unless you're living in an island where nobody enters or leaves ever, then you're safe, right?
Yes.
Potentially, at least from COVID-19. And so this idea that we're all interconnected and the world is interconnected as a whole. Um, but even more important is that, like, if we don't act responsibly and do the things like wear a mask, practice our social distancing, don't do unnecessarily gathering and partying with your friends to see who's going to get sick faster. Um, we have a responsibility to each other, and so let's say, for example, you think that, oh well, I'm not sick, nobody in my house is sick, so I'm just going to go out and live my life as though nothing has happened, right? But you go to the market or the grocery store, and you buy something, right? And somebody there is sick that gets you sick, and you take it home, and then it affects the people in your house. But let's assume that you have it and you're gonna survive, you'll be okay. But you
Right.
pass it on to somebody that
Mhm.
then passes it on to somebody else. That's the doctor of your sick mother, right? Or your sick parent. It's like it's such a loop of interconnectivity and the ability to transfer it from one person to the next, right? That we all sort of are at risk, right? I mean, I think there's a segment of the population in terms of age that are a little bit more susceptible to it. But we're learning every day that younger folks are also getting it and also potentially at risk. So I think everything you do has an impact on somebody else in this scenario. And I think that's become clear as we've seen things unfold and happen. And so I think as a humanity, right? Like we just have to be willing to look out for each other and really take this
Yeah.
seriously. I mean, I think we're not gonna die. We'll find other ways to survive, as we've all done, and it's
Yeah.
gonna be uncomfortable. But understand that when you act responsibly, let call yourself a hero. You're saving
Yeah.
lives,
You
right?
know,
Act responsibly and save a
I'll
few lives.
I'll say this. I think they are. I think humanity is often presented with certain challenges, and it happens on an individual level as well. But we're often presented with certain challenges, and we can rise to those challenges or we can fall to them. It's almost like running up to a hurdle, right? You can get over the hurdle or you can hit it down, or you could choose not to go over. And I think we've got a situation here where there have been many challenges, throughout our lives, as individuals, and even in the countries that we've been fortunate to live in, where challenges have arisen. And here is a challenge before us as individuals, as a community, as a family, as a country, and then also as a world. And I think that we can do best to rise above these challenges when we work collectively rather than against each other. And I think what's really important here in this case, because the very existence, right, of humanity might be resting on this, I think we have a moral obligation across the board to take any necessary precautions in order to ensure that we can see people continue to live, right, a certain quality of life, and that we aren't losing friends and loved ones simply because of negligence. And I think for once in our lives, right, we've got to take something seriously, not simply because you may not be at risk. I think, as you have nicely laid out, Richard, your grandmother, your grandfather, your child, right, your neighbor, somebody else would be at risk. Look at something that started all the way in China. If you only felt connected to China by the television that you bought, right, now you are connected to China by the very ear. The first person who inhaled COVID, and then that spread to the rest of the world. Look at how that connectivity has really led to connection across the entire globe. If we don't come out of this realizing how connected we are just as a human race, and that we need to work on things collectively and together like this, I think we would have failed this hurdle, and it will take us another challenge for us to kind of figure out. And it's going to be at a very high price. It's going to be, remember the numbers, 610 deaths. I don't think we need to have another person die for us to realize that we've got a serious responsibility here, right? To take the precautions necessary to protect not just us. Wearing, I don't know where my mask went, but wearing this is not just to protect me, but to protect those around me. And I think this is an opportunity for humanity and people to rise up and actually contribute. It seems simple, but I think it's powerful.
I agree. And I like that line of superheroes are wearing their masks. So let's all be some superheroes and
Yeah,
mask up.
look at this shit. Put bust up on your chest and up and
Wearing a
away.
mask, by wearing a mask, you're saving lives. So call yourself a superhero
There
and
we go.
put your mask on.
Let me be Richard. We have to get like superhero names now. You can't just be Richard and Kofi anymore. But
No,
I'm
but
Vaccine Man.
this was a worthwhile conversation, and thanks for taking the time out, and hopefully we'll hear from some other people that have some views on it, and hopefully some people find it valuable as well.
All right,
Thanks,
man.
man.
Guys,
All
take
right,
care. Bye.
expand the conversation.